Hey everyone, we've got another specimen today. This is 405 in our collection. The heart would have sat in the chest roughly like this. So anterior surface coming out towards the screen, posterior towards the turntable, superior in the head would be up here, inferior in the legs would be down here, left, and this would be right. And so we'll start off as we usually do by finding what appears to externally be the right atrial appendage. And right off the bat, we can see a broad-based triangular-shaped structure that looks like it's a right atrial appendage. So why don't we go ahead and open the heart and start there. When we do expose this atrium, we do see pectinate muscles that spill outside the confines of the appendage. They've been cut away here, but you can kind of see hints of them up here too. So consistent with the morphologic right atrium. You immediately can also see the oval fossa and appreciate that there is in fact an oval fossa type interatrial communication here. And then we can also find the mouth of the coronary sinus, which is kind of recessed in here and is a little small. I'm sorry, it's hard to demonstrate that. But the mouth of the coronary sinus is in fact here. And then both the superior caval vein and the inferior caval vein can be seen coming back to this right-sided morphologic right atrium. So once again, in the morphologic right atrium, we do have a oval fossa type interatrial communication, and then here's the coronary sinus, and then this would be the tendon of Totaro. So our triangle of Koch would then be bounded by coronary sinus, tendon of Totaro, and then the hinge point of the tricuspid valve, and so that the triangle's apex would be roughly here, which would mark where the atrioventricular node would be expected to be. When we go ahead and look at the right atrioventricular junction, we do find a atrioventricular valve that appears to have 3 leaflets. And this valve also has septal connections, which you can see here. Consistent with a morphologic tricuspid valve, we would then expect that this ventricle would be a morphologic right ventricle, and it does have coarse trabeculations. And there is a septomarginal trabeculation here, so consistent with a morphologic right ventricle. Now, when we look at this right ventricle, we get up into the outflow tract, and we do find that there is a semilunar valve here with 3 leaflets, 1, 2, 3, and 3 sinuses, 1, 2, and 3. There are no coronary arteries arising from within the sinus, and the pulmonary trunk arises from this and gives rise to both the left and right branch pulmonary arteries. So this is the pulmonary valve, this is the pulmonary trunk, and then the branch pulmonary arteries come out here. Right? And right next to it, we already do see the ascending aorta. And it looks like the ascending aorta is right next to the pulmonary trunk. So here is the ascending aorta. And you can see the transverse arch here and the head and neck vessels. So we'll just put our probe down the ascending aorta to find where its actual opening is. And we find that the ascending aorta, in fact, arises right next to the tricuspid valve. And this is the orifice of the aorta right here. So if we placed our probe through this, we find that it comes out the ascending aorta. And so this aorta is in fact rightward and posterior to the pulmonary trunk. And both the aorta and the pulmonary trunk arise from the morphologic right ventricle. So this is double outlet right ventricle. Now, generally in the setting of double outlet right ventricle, we do expect to find a ventricular septal defect, but we find that the outlet of the right ventricle is intact. We don't find any muscular defects, and we don't see any central defects living behind the tricuspid valve. So in fact, this is an example of double outlet right ventricle with intact ventricular septum. And once again, here is the aortic outflow, and here is the pulmonary outflow. And the aortic valve does appear to be trileaflet. If we try to look at it down the barrel here, and it might be hard to notice, but you can kind of see the aortic valve. There are 3 leaflets to it. And so a normal aortic valve, a normal pulmonary valve. So why don't we turn the heart to the posterior aspect, and we'll try to find the left atrium. So here we find a small chamber with a smooth vestibule consistent with a morphologic left atrium. We can see the oval fossa type interatrial communication from the left now, and that's here. And immediately we find that there is no left AV valve. So there is atresia of the left AV valve here. There is no egress from the left atrium other than the interatrial communication. And when we try to find a morphologic left ventricle, we do find a small, incomplete left ventricle here. So left atrium and a small incomplete left ventricle with no left AV valve. So that is a specimen with double outlet right ventricle with an aorta that's rightward and posterior to the pulmonary trunk and with intact ventricular septum.